Okay, today is Wednesday, February 28th, 2018. This is Hannah Crawford for the Global Polio Eradication Initiative History Project. I'm with Dr. Elias Durry in the broadcast studios of the U.S. Centers for Disease Control and Prevention in Atlanta, Georgia. Todd Jordan is our videographer, and this is our third interview. Dr. Durry is currently Africa team leader in the polio eradication branch of the Global Immunization Division of the Center for Global Health at CDC. He's also chairperson to the Outbreak Preparedness and Response Task Team. The interview today is going to focus on your roles since South Sudan and working in Nigeria. So basically 2007 to present. Thanks for being here today. And do we have your consent to conduct the interview?
Yes, we do.
Great, thank you. Would you introduce yourself by name and then to pick up where we left off, more or less?
Thank you very much. I'm Elias Durry, working at CDC. Just to update your introduction, actually currently I'm coordinating the CDC's outbreak response for polio.
Thank you.
We talked in detail about while I was actually detailed overseas, meaning up to 2007. And then from then, I came back to Atlanta and took on to be the team lead for the EMRO regional office. EMRO is Eastern Mediterranean Regional Office. And at that time, it was just, trying to still continue to support some of really high-risk countries like Sudan, Somalia, of course, Pakistan and Afghanistan. In between, I was also traveling to India, for their last years to support the activity there. Other than just sitting in Atlanta, I went back through WHO to South Sudan for about a year. This is when they had reintroduction of the wild virus, the virus that came originally from Nigeria. So South Sudan was also one of the countries that were affected at that time, in addition to Somalia, Yemen, and across the belt, of Africa. And then after I returned here, what was going on between 2007 or 6, especially after the close to eradication of the virus in India, we felt like we were stuck at low level of cases, not about, in less than 1,000 cases. And really, we just, especially after India has eradicated, the globe and all the partners really got very concerned that if we just continue going the way we were going, we will never reach there. It's like a slow death, with no major or game-changing situation in both Pakistan, Afghanistan, and Nigeria. These countries were just stubborn. The activity was going on for years. It became like a day-to-day activity. The commitment from governments cannot be there was nothing that to compare it to, so it's just a normal activity. So in 2011, the World Health Assembly took on the issue and really say that from now on, polio eradication cannot be just as any day activity. And they have raised it to the level of calling it public health emergency of international concern.
Margaret Chan, right?
Yeah. And they have demanded or asked each of these 3 countries for the polio program to be run, at the level of presidents or prime ministers. We have demanded that each country will come up with emergency action plan and so on. So in 2012, I was asked to go and support Pakistan in its effort. So it was clear that we could not do those things that had been, that, you know, we could not eradicate polio. You know, by that time I went there, there were about more than 145 campaigns, and everybody is just doing the same thing. So what we did was, as soon as we went there, we came up with the National Emergency Action Plan. And this action plan called for you know, not only what to do, but especially accountability and responsibilities. The core issue was really to take the polio eradication out of the Ministry of Health and bring it up to the highest level of the government, meaning at the Prime Minister's office. And it called for a special representative to run the program, who is answering to the Prime Minister himself. So and our meetings and our activities were also going to be managed in the Prime Minister's office. So, but when you go further down, also at the you know, provincial level, there also was supposed to be run by the Chief Minister, which is, you know, the same level of the Prime Minister. The second thing was that the overall polio activity in the field will not be just run by the Ministry of Health or the Ministers of Health. The Ministers of Health will collaborate, but it will be run by similar to mayors level. They call them deputy commissioners or commissioners. And it meant that the deputy commissioner or commissioner will put everything that they had to put on the table to make sure that children are immunized. And especially to make sure that a lot of you know, issues that were hindering from reaching to every children, to fix that. For example, WHO gives money for the campaign to the Ministry of Health. And the Ministry of Health will keep giving it to, you know, in ranks all the way down to the field. And as you can imagine, you know, it's a cash money that used to go to them. As you can imagine, everybody is obviously looking for ways of getting more. So what you see in the field as vaccinators, either they are small kids, or, you know, even those ones who go out who really take this as part of their income, they will not do their work, so they will not really go everywhere that they need to go. Basically, you have a large chunk of population that are never reached or will not be reached. And with that kind of thing, you cannot eradicate polio if you don't reach every children. So when we brought in the deputy commissioners, we raised the stake very high, and in a way that even the performance of a deputy commissioner in his, you know, other performance measures, what he did in polio or what she did in polio will be counted. So it really had a very serious impact in their own political career. So, but although the fact that it was just a quick, you know, a dramatic and a, you know, a major change, it's helped the program to be really taken seriously. The deputy commissioners will resolve any issues that will come, whether, let's say, you know, if certain group of people, you know, want to really continue to sabotage like they used to, these deputy commissioners have the power to even arrest them, because they are, you know, they are there. So that was one big change that we brought in. And then the second one was just to make sure that the money that is given to the children, I mean to the vaccinators, will not be, again, you know, misused. So we came up with payment of the vaccinators, which are about 220,000 of them, through a banking system.
Like Hawala, but not.
No, we receive their names in advance. We submit their names to the bank with the amount and of days that they work. So when they go to the bank and they show their ID card, and they receive their money. And with this, we actually, hit two birds at the same time, because number one, we knew that vaccinators will receive their money, so no one will be, no one can cut corners and hire less people that require or so that's number one. That the other one was also that to have an ID card in Pakistan, you have to be 18 or above. So that way, we also removed all of those, in Karachi, for example, 60% of vaccinators used to be children 8 years or 9 years and 11, maximum 12. So both by bringing by motivating the vaccinators, and also by making sure that children vaccinators will not be in, and with that we were able to kind of again give it a higher profile with some fairness in it.
Can I interrupt for a moment?
Sure.
One of the questions that came up, I was reading a book called Chasing Polio in Pakistan by a scholar named Svea Klosser. She's at Middlebury.
Yeah. I know.
One of the focus of some of her research is this question of why, in a time when global health is receiving more funding than it has ever received,
Mm-hmm.
are we relying on volunteer efforts? And why are people in positions like polio health workers not being paid more? And I wonder if you have any thoughts
Yeah.
about that.
It's really, when we started the whole all this stuff as volunteers, and we never thought that we will go this far, that we have to be people. Really, it's a volunteer spirit. It was. I think it's difficult to say whether the payment at that moment, or I think when I went, I know that I have doubled it. What they used to get when she was there. She was there before me, and I know that when she was there. But it's not. It may not be enough. What we want to do is just have people also, not they do it for the money, but they do it for a cause, and they come out and whatever they need for them to to get that day over, whether the foods or the transportation, and plus something that they can take home. Although eventually, because it became such a continuous activity, it became source of income for a lot of people, because it became, So I can understand what she's saying, but I think the volunteer part. I've seen a lot of them. Even when we had a difficult time in the later years, even at that time, they were just willing to come out and do what they had to do.
Did you see new kinds of impacts of when people started being paid, like the change from volunteer to paid workers?
Well, in all these countries that we have, as I said, a kind of long-lasting activity, I cannot tell you this one or that one, but I can tell you a lot of people made a lot of money out of it. This is obvious, and that's why when we started, working in Pakistan, we one of the things that we really wanted to do was really bring in accountability at all levels, meaning, that we can measure what people are doing, based on what they plan to do, and it brings also, it's a resource. It's a lot of resources for sure. And what happens is usually these resources also is managed by the central government. And like I mentioned last time, like for example in Nigeria, I remember, when the locals in the north, they felt that they had nothing coming to them from everything that is available. The aprons are made in the south, the papers are printed somewhere else, so they had nothing to gain out of it. It's not only the payment of the volunteers, but there is so much other thing that rent vehicles and all this, which usually ends up in the elite group of the country, and that brings in a lot of those ones who already have deficit, trust deficit in the government, can see these things, and then it brings a lot of problems. Why are you're not working with us? So you are part of them, so we don't want. But I think for Pakistan, it was not only the money part that was changed. It is really the whole attitude, and for us also to come up with a very solid technical advice. Because in 2011, I think they have 298 or some large number of cases almost everywhere, and it was very good when the 2012 came in with all these inputs from all different parts, and we did a very good job. 2012 was very successful, enthusiastic. Everybody was in it. The media was in it. I mean, it was really good. And we were able also to, at least cut the number of cases in places that did not have any major other issues, like social issues. But then even in places, one of the other problems of Pakistan, in addition to what I said earlier, is the issue of the tribe that is mostly affected by the virus is the Pashtun tribes, and it's not just a tribe, but I think what it is they also their area is also a tribal area where they can rule their place according to their tribal traditions, and as you can imagine, sometimes there is difficulty in allowing people to get into their houses, or allowing women to work. So that always used to curtail the number of children we could reach, because as a tradition, they don't allow a man to come into the house, and then they don't allow women to work. So where are you going to get this kid? So what they used to do and what they do is, in every village there is a place like a guest house kind of place, where guests could be put there until since no one can go from house to house or any house, they put you there. So sometimes they gather the children there, and then but you don't have a chance of asking, is there any more child in this house or in that house? You can't go house to house. So that that was an intrinsic problem that we had, and we still have even now, both here in Pakistan and also in Afghanistan. So that's a blowback from a tradition which it's their tradition. We can't do much about it. So because of these things, there were few places that we called reservoir in Pakistan, few areas, and among them, the worst one was Karachi, and in Karachi also areas where the Pashtuns are residing. The whole Peshawar, that's in the north. It is close to Fatah, the tribal area, and then the other one is Quetta, what we call Quetta block, in the east, and that's also heavily populated by Pashtuns. And in addition of that tradition, there was also problems with the acceptance of the vaccine or by the public, with all the similar rumors that were in Nigeria, in these communities. And then you add to that the influence of Taliban also. So we had few places that we knew what we call reservoir, that we were really hoping that we'd be able to overcome the problems. Although 2012, Karachi and Quetta did well, but the area close to Peshawar and some of the other districts close to Peshawar, they had some breakthroughs, and we have like 56 cases in those areas. And then came December of 2011, a disaster. This is the day when they started to shoot volunteers, and the first day, I think we lost 9 volunteers in 3 places at the same time. From then on, things just went, now in 2013, things just started to go down the hill, because, these places that we really needed to be and work became really a war zone for us, for the polio program, and we were specifically, or the vaccines were specifically targeted, and again, it was not in any other place, but it's the place where polio was flourishing, and that took a lot of momentum from the initiative that started in 2012, and I think we are still, although it's much better, but I think the consequences we're still paying for that.
So in 2012, there was a leaflet circulating, right, that was communicating that vaccine would cause infertility.
Yeah.
All kinds of rumors and misconceptions. But that wasn't the first time the Taliban had interfered in vaccine or...
No, I mean, the Taliban, they have interesting, actually, engagement with the vaccination. When they used to be running Afghanistan, they were very supportive. But also before the incident of started killing, and I mean, you can say it before the incident of Osama bin Laden also, there were these rumors all the time. These rumors were there all the time, but we were able to kind of sometimes cheat the virus also, but work with the community also, with some of the religious leaders. What I mean by cheat the virus, what we were doing was, we were using what we call short interval additional doses. So rather than going and immunizing every 4 weeks, we were immunizing them every 2 weeks to quickly raise the immunity of the children, and also to cut the possibility of the virus to keep circulating for the next, So that helped us a lot. But, that was really like trying to, like I say, cheat the virus and really get out of there as soon as we could. It helped, but polio eradication is not a whack-a-mole. If you do it like that, you will never, if you work very hard in one area, and then you have a problem in another area, once you are done with here, the problem from the other area will come also, so we had to do, we still have to do these good campaigns and reaching every child at the same time across the board. So all of those efforts that we brought in and the government brought in get really seriously challenged by the killings. So I think, then we had to come up with different ways of doing, and basically it was 2 strategy. It is negotiated access or protected vaccination. With negotiated access, what we try to do, like in Karachi, and now it is expanded tremendously, is to give the community all of the necessary, like the way we were doing, like I was telling you about with Somalia, but here more, allow them to choose their own people, and especially women from their own, they have to decide who those persons are, and give them an opportunity where they don't have to come only for the campaign, but work throughout the month, in sitting and discussing with the parents, and and so that's what we call by negotiated access. So we don't go in, but they will do the work as much as they could. And currently, that strategy has been expanded to a lot of places, and it's fine. The second one was protected campaign. Protected campaign is not something that we really wanted to, but we could not let out vaccinators in these places without police protection. So every vaccinator, either they are encompassed by a group of police, or they are escorted by the police. That is okay to some extent, but it is not sustainable to go back again and again. And there are not enough police in the world to come and do this all the time. And that really affected. Then we could not do campaigns at the days that we wanted to, or we could not have, or they extended for like what they used to be 3 days, like 10 days, and it was just 2013 was just lost like that because we could not do anything serious about it. Although there was a great commitment from the government to protect the vaccinators, but it was really difficult and almost not impossible, but very, very challenging, because you can, with the media and everything. Also, when any of the shooting happens, everybody hears about it across the country, and all vaccinators started to really, get panic again, and then stop it here, stop it there. So it was not a good, it could not do the job.
House to house, how were Pakistani police received by families?
You see, the problem is where they are not already received well, because in the in suburban and places that there is no problem. But in these places that where the killing happens, sometimes even the police doesn't go in. It's already a hostile community. So it could not be the final solution for this. So what we did was, in addition to really working with the community and with the religious leaders, I mean, that was a full-time job of us. That's just trying to figure out how to convince and come up with a way that there is. Of course, the Taliban has kind of said it officially that they were not allowed to vaccinate. So it's not kind of whether they are in it or not in it, but they made official announcement that they will not allow. So so in addition to what I said earlier about community participation, we also started, very heavily to be engaged with global religious leaders, including, Mecca and Medina, the mosque in Mecca and Medina, bringing scholars to the country, taking the scholars, religious scholars from Pakistan to other countries, and so on. So there was 2 districts or administration in the tribal areas where the Taliban officially declared that there will not be any vaccination, which is North Waziristan and South Waziristan. So even when we were immunizing kids in Karachi with a lot of difficulties and all, these 2 places were absolutely not touched. So it was where the Taliban has a stronghold, and you can, it's so as we expected. Then a big outbreak came out of the same place, North Waziristan and South Waziristan, if you look at the number of cases. So while we are struggling to kind of manage the killing on the other side, on the other part of the country, we just could not do anything about two places while we see that more than 140 kids were paralyzed. So, and then viruses from those areas come out and infect other areas. So Well, then I think in 2014, something serious happened in Peshawar. Okay, before that also we started to also engage with the military, with the army. Because this what we call FATA, this tribal administered areas, they may have what they call commissioners or whatever, but it's really run by the by the army, because it is bordering Afghanistan, and movement and everything is. So we knew that to do anything there, we cannot do it without the help of the army and without the knowledge of the army.
What kind of knowledge did you need from the army?
I mean, they just need to know where we are, where our people are going, or when we are, when the campaign is, because they don't like people just to move around in those areas. So we established that relationship, and we were telling them that, especially I was telling them that there was really, we cannot just leave this issue of the killing to the police and to the administration and others, because I was not hearing any narrative from the government side, because on the Taliban side, they tell them you are spies, you are this, and you are, this vaccine is sterilizing our children, but nothing was coming from the other side to say, not just to answer those claims, but to come out saying, look, anybody who is attacking the vaccinator is like attacking the government itself. So don't dare doing it. Things. I mean, in addition of doing all of the other things that we try to convince about the safety of the vaccine, but the fact that anybody who could do that could get away with it, and again and again and again, was not really a good way to eventually stop the killings. So we were asking them to help us, number one, in places like Karachi, to bring in the army, to make sure that, because even with the police, you see that the police get shot, and then the people, just really have a major presence of the army with tanks, okay? So at least to give kind of a circular protection if something happens, if nobody gets out. The other one was we were asking them to help us to immunize children in the tribal administered areas where they have control on. One good example is there is a place right by Peshawar where there has never been, vaccination for years, and it is held by kind of regent Taliban, not Taliban, or but sometimes they go in and clean places, So what we wanted to do is for them to actually go in and conduct the campaign, whatever way they feel is appropriate. And then the third one was the issue of North and South Waziristan, where the Taliban has declared, no campaigns. And then I think in 2014 or early 2013, if you remember, there was a major attack by the Taliban, the school that the children of the military go, and I think they kill about 134 of them. I think when that happened, and then the army also started to get really serious, and they started to implement what we always tell them: there is no good Taliban and bad Taliban, because they had this management of things that this is a good Taliban, this is a bad Taliban. So eventually they went into North Waziristan and South Waziristan with big power and with big force. At that time, everybody in that place had to get out in these two places. But what we asked them, okay, when they are clearing the area and asking people to evacuate, of course they allow people to evacuate only to go through certain roads, and so what they did was anybody who was coming out of that place, including if you are an 80 or a 90-year-old person, would be immunized when they get out. And we have immunized, like, I don't remember, millions, including. And then what we did was, in addition to immunizing them when they come out, we were also continuing to immunize them because they were taken to unknown areas. And some of them used to go into the community. So we went and followed where they were and immunized the community and tried to really mitigate the fact that they are coming out from a very highly infected, or where circulation is very high. And that was also really very, very good. And then came Peshawar.
In 2012?
This is 2014.
Are these the high security one-day MOP campaigns?
Yeah.
Okay.
So, in Peshawar, we could not really do campaigns because either it takes 20 days or half of the place is not reached, and So during the discussion, so we keep going to the police station or to the police and the police army, and we keep presenting our case that we need to really do campaigns, but very short period. But at that level, we just couldn't come up with a solution because they don't have enough police. They don't have, we don't have enough time. Then somebody gets shot, and then the whole thing breaks apart again, and so the whole year went like that. And then when we were able to bring in the political party that won in that area,
PTI?
Yeah. We went there and we told them, we went to Imran Khan, look, this is in your hands. You can, if you want to, you really can make this thing happen. And in addition of giving his own name to it, but the first thing that we need is number one, to try to change the image of polio, of not being polio campaign, but we promise that we will do other immunization, but not house to house, but we will give coupons to families to go and tell them which health center they need to go and immunize. We were distributing, things for sanitation and stuff like that. But he had to take it as if it is his program.
So this is part of this. These campaigns are covered in Every Last Child documentary,
Yes.
2014.
Yes.
So just for the record, the politician you're talking about is Imran Khan,
Yes.
correct? And the PTI party, which translates as Movement for Peace
Yes.
Party.
Yes.
I just wanted to record that.
Yeah. So I mean, the challenge was, okay, we were able to bring him in, but then the challenge was, okay, how do we ensure security? So
Could you go back a little bit and talk about the need to rebrand? Polio workers were being targeted. The Taliban had said no more polio vaccination.
Yeah.
And so one question I had watching the documentary was this approach geared toward people you would be visiting door to door, or was this to not disguise, but to rebrand polio to draw attention away from polio for the Taliban?
Yeah, I think probably what I would like to add is, to be frank with you, is that somehow, not as polio program, but somehow the polio team was utilized to hunt Bin Laden, and to hunt Bin Laden, and that became, an open secret, and the Taliban were very pissed off at the fact that the program that they thought that is polio is also engaging itself in something else, including spying. So the reason that the Taliban banned campaigns in northern South Waziristan is specifically because of this reason, number one. Number two, they were also demanding that the drone attack stop before they allow campaigns. And number three, of course, the usual misconception that they give. So it was so. Then with this kind of news and with this kind of discussion, even for some non-Taliban, even for normal people, suspicion on polio was really very, very, very high. And we had to find ways of, we keep telling people that no, it's not a polio. There was a hepatitis B campaign that they were using because polio is a drop. So if you wanted to take a DNA, you can't get it. The only way they try to take the DNA is by giving an injectable vaccine.
So Dr. Shakil Afridi.
Yeah.
Okay, it was hepatitis A.
So, but you can imagine how much, what was the belief of everybody's belief that, these poor girls who come in and they take information back with them, to be attacked, and they blame us sometimes. Drone attacks are every time is there. Vaccination is also all the time there. So, it's like it happens, but also they used it as a political hostage. They knew polio eradication globally is an important issue for the West, and they really made sure that that does not happen, not because they don't like their children, but just they believed so much the fact that they have to derail this Western agenda. I remember in Kuwait when a child was paralyzed, when the father was actually throwing a party, inviting everybody for lunch, saying, "Look, God bless, my child is paralyzed." I mean, this is a man who is supposedly a religious leader. So, because of all of those previous non-Islamist, mentality that they had, it's made by the Jews, it's made to, because of that, and because of this connection with what happened with Osama bin Laden, the taste for polio was not good. People were leaving us. I remember I had to bring in psychologists just to look after my staff, and more than 65 or 85%, almost 85% of them needed some kind of medication because it was so distressful and so difficult. And nobody wants to work with us because it is like a death sentence for that person. It can be, but not the issue with the safety. But the polio name was not a good name. So we had to do two things. We had to take it off the polio name by itself, from it, take the polio activity from it, and also make sure that the other part, the safety part, and the fact that it's not something that is sterilized and all. So we had to attack that through religious groups who would explain that this is not what it is, because some of them say it is forbidden religiously to give vaccine because of this and this and that. So what we did, in addition to what I told you about the religious leaders, we also tried and succeed very hard to make it look like it is supported fully by Islamic organizations. So we immediately changed our source of money from other place, and we went and borrowed or got money from Islamic Development Bank. We brought in the UAE parents and to at least lead an effort openly. So at least to take away, and basically we have to Islamicize the program. And then on the other side, we also have to take it away from being polio and call it something else. Movement, what we call it during Peshawar is Sihat Ka Insaf, is unity for health. And we were saying this is really not polio, and we were giving other things, but of course polio was in it.
Did anybody ever say, hey, but polio is part of this program?
Don't get mad at me, but my thinking was, if people are so gullible that they think that this polio can do all of these things, I mean, why can't you also? I mean, I'm not saying you say it in a wrong way, but yes, we said this is not only polio because we made sure that families go and get the other immunization. What we did was we made sure that the health centers are fully equipped to get all of the vaccines.
And there were 9 of them.
Yeah, I mean, all the necessary vaccines. So we're not giving them house to house, but we made sure that all health centers, that each family will have a coupon with them, and they do 2 things with the coupon: get vaccination and also get hygiene kits. So it was not a lie, but we were not giving them vaccines all at the same time, or we were not saying that this vaccine cures 9 diseases.
One of the arguments that came up in the film, that there's a scene where a family and men from a family are meeting and having a meal together with kids around, and one of them said why they're trying to just attack this one disease when there are so many diseases in the world, which echoes conversations that have been had at like the global health level.
No, that was a very challenging, and we've done a lot of job. I mean, I didn't mention about in removing trashes and stuff like that. And especially Rotary International was very, very active in going into these places. Remove trashes that are like trucks after trucks and after trucks, and I mean, it forced us to really think about how we also do things, which is just always highlighting the polio part and then just not thinking about the other need of what the community requires. And we try to do that. I mean, that's why I said, if you ever do again, we have to start doing these things in the most difficult areas, because as time goes by, you will never know that polio is the only thing that we worry about, in quotation, unless we do this for a long time. Like if it is a short period of activity, okay. But if you do this for like years the way we are doing it, and the same person who would tell a mother at the health center that there is no Tylenol or aspirin and goes to her house and say, take this, again and again and again, that's a challenge. So the thing, and then when we discussed with Imran Khan and the police, we could not come up with ways of really ensuring security of the vaccinators. But then I remember that there is, once a year, there is a holiday called Ashura or Muharram. And this is the one which you see when the Shias, beat themselves, For that day, across Pakistan, every place is not locked down, but every place is safe. I mean, not safe, but they because there is a tremendous attack on Shias during that day, every year. So the government knows that, and for that reason, all places, they have a protocol how to maintain safety for that day. Coming from the army, the police, all of them. So when we're discussing, we're saying, 2 days, 1 day. And then I asked them, I say, how do you do Muharram or Ashura? Say, can you just go back look at your Ashura protocol for one city? Say, yeah, that's that we do that every year. I say, okay, that's all I want. And you do it for one day, but everything else is you don't have to come up with ways of doing it. Just do what you've been doing for Ashura. And then they say, okay, it's easy to explain. And it was really, I mean, and I don't like to talk about it, but it was really an amazing thing. They started work on Thursday, and they go and whoever they feel like it is troublemakers, they held them until the campaign is finished. Yeah, they put them in jail until the campaign is finished. During the day of the campaign, no motorcycle. In some areas, no phone. And in some areas, complete quarantine, closing shops. So you see, so it is a very major activity, and you cannot do this for 2 days. So it has to be one day. And then you cannot ask them to do this for the whole of the year. So I asked them, okay, give me 3 months. I just want 12 campaigns, and let's get over it.
And that's what you did.
Yeah.
So there were 12 one-day vaccination campaigns, and you immunized, I think, 700,000 children, or 7 million? Million children.
Yeah.
So they proved to be effective.
Very effective.
Did you consider doing any more than 12?
No, 12 was just actually stretching it. It's not only the numbers, actually, it's also the timing at that time. We were doing it like this time of the year, when the circulation is the lowest, so we call it a low season. So that brought back the program a bit, in a sense that at least it gives us a relief that it can be done. But, we could not do the same way in Karachi, but Karachi also picked up a little bit. There were more police. But then, as time went by also, I think it's clear that as I said earlier, you can't just force these things with the army. So after I left, I think what was really got more concentrated on is really bringing the community. So there are these community volunteers that almost cover most of these high-risk areas, whether it is up in Quetta or in Karachi or in some of the difficult areas. And, there was a major progress, but again, we still are missing some children that we cannot. Knock on wood, we don't have any case this year, and we hope it will remain that way. But unfortunately, we still see viruses in the environmental sample, which we hope is just the tail end of the circulation.
It seems like one of the differences between work in Africa, or at least in South Sudan and Somalia, or Somalia particularly, where you had advanced notice, you were pretty aware of what was going on politically between clans. It seems very unpredictable in Pakistan. So how did you learn to navigate that?
I think if anybody thinks that they can follow the politics of Pakistan, would make a big mistake. It is, I can say it here. I was actually suspicious whether even if the army is not part of these things. It is just what they are going through in their politics, whether it is geopolitics or their animosity with India or what they want to do in Afghanistan and all. It's so complicated that anything outside of each of the units that they are working outside of what they are thinking would be any value to them. So I'm, I don't, I mean, of course, people question all the time the engagement of the Pakistani government to or the military with whether they are cohesing with the Taliban sometimes. That's why I said earlier they have what they say, the good Taliban and bad Talibans. So and the politics, even the political level, like for example, when I was doing this in Peshawar, I've been having a very difficult time with the central government. They thought we are giving a lot of credit and a lot of face time for Imran Khan. And you don't know how the army thinks. You don't know how. I mean, it's just, and it's not. In Somalia, it is to fight for the little thing that they have. Here, it is way beyond what this is their political Pakistan's stance in the place, and I don't want to get into where they want to go and what happens with their neighbors and all. But it is not a small place that you can say that I understand this politics. You'll never. I don't think anybody would.
Were you briefed before you went?
No. Briefed no.
You briefed yourself.
I mean, we know. I follow politics, country politics very closely, but so if anybody says that, the same thing, I understand the same thing, There are too much external interest and long-term interest or national interest that you will not get into it. In Somalia, there was no national interest.
I had a chance to sit down with a Rotarian named Aziz Miman. Have you met him?
Yeah, he's a good friend of mine.
Oh, nice. Yeah. Would you talk about him a little bit and his work? I'm looking at this point for connections between your work and partners.
Yeah. No, I mean, he is, and he will be a very, very useful ally in a place like Pakistan. He leads the Rotary International, and he is very knowledgeable about the program. But he is also very candid about telling people what are the problems and what it is. But not only in telling people, but he's also very willing to establish this community-based activity. I mean, he's very helpful, and like I said earlier, most of these sanitation thing that we did in Karachi is because of him. He established a lot of activities around the border areas between Afghanistan and Pakistan, providing all equipments, not small equipments and things that the vaccinators require, like most of the transit vaccinators. They are the one who provide them with their uniforms and shades and. But overall, not only in doing these small things, his voice and his impact is really phenomenal.
It was striking to hear him describe, even interpersonally, his interactions with people, especially when parents would resist vaccine.
Yeah, he should sit straightforward and say that the way it is. Yeah.
Yes. So we talked a little bit. Would you talk a bit about, and I will probably mispronounce this name, Babar bin Atta?
Yeah.
Could you talk a bit about people that you worked with closely? He's an example of one person that you worked with.
Yeah. Well, let me say this. In the field, if I need a medical officer to be thrown into very difficult areas, I'll go look from MSF.
Doctors Without Borders. Mm-hmm.
If I need a communication person, then I go look for someone who works for the tobacco industry. So I mean, what I'm saying is they are aggressive and they will make you believe it's not there. So Babar was working for polio with UNICEF before I arrived there, before me. And he quit. And then when I came back, what happened was in the middle of that normal work before this killing started, there was this TV show, TV anchorman, who just sat there for 2 days and just really trashed polio and all of these bad, misconception. And he just went on and on for 2 days. And he's one of the most famous talk show hosts. And, this is not when the Taliban were doing it. He was just coming up, with people who probably did not get paid or whatever, or did not get money, and they come and they say this vaccine is this, we give bad vaccine, this vaccine. And when he, and then that 2 episode really became a big headache for us, and we were not ready for it to respond back, so basically we were not. UNICEF was not ready. WHO was not ready with the communication people that we had. So I had to bring him quickly to kind of work with the media on that. And that's how he joined me. And I think, I can say that, I really had a very good relationship with the media there.
As good as you did in Yemen?
Oh, much better.
Could you explain?
No, I mean, of course, journalists are journalists, but also it's not in my nature to, hold things back or whatever, just say, you can explain everything. It's nothing that is not explained. So, I work with them regularly for if they want to write something, so sometimes I can have also things to say, okay, listen, if you say this is what happens, so can you just not say it, And it's not, it's not that because I give them and they do, but I mean, the way we were discussing, I was discussing with them is really, is openly and with science and. So, sometimes I know what they were writing the next day, so, in advance, and if you have things that, well, I also call it, there is a way of working for me was, I call it special memo. Meaning, if things don't go right, and then, you just talk about it on the news media, and then in the afternoon, probably the president will call and say, okay, how come we don't have vaccine, So it was a good relationship. So he was managing all of those things. Sir? I think, it may be, going back and think about it, may be a little bit too much of media. But I think in places like Pakistan, if you want to keep everybody on their feet, it's not shaming, but it is really important that we all are on the same, on the same page on where we are going. For example, in Quetta, the vaccinators, they used to have a union. Well, recognized union. So they would not allow anything to be changed. Like when we brought in this, when we brought in the issue of direct disbursement through the bank, they would not accept it. So what I was saying was, that then we came up with criteria for the campaigns, which we call a deferment criteria. If things don't happen, whether in planning or whether in preparation, then that campaign has to be deferred for a week. to fix that, for a few days. If second deferment comes, then we need to think, I said, we need to think about outsourcing the campaign. So that Quetta place is just such a difficult place, especially because of this. So what I'm trying to tell you is, that then I sit and I talk with a journalist and say, if campaigns are not done well, we're going to outsource the campaign. So that becomes an agenda of, and probably tomorrow, the next time when we go and we start discussing, we start with something, So there was a lot of things like this that we were using it for.
Any other uses of mass communications or media?
Well, a lot of people didn't like it, but I used to put out the cases, number of cases on prime time.
Why? What were their objections to that?
Because we were not supposed to have any case. I mean, so whatever it is, it is just to ring the bell that we need to move on. The one thing that is really, I don't know how much you know about the media of Pakistan. They try to replicate or duplicate what the Indians did. There are so many channels, and they just, some of them work with the government, some of them work, there's just so many of them, and there is so much of breaking news mentality and stuff like that. And
kind of, I've seen images of news teams in India, and they, look very strong and ready to move.
Yeah. And eventually, the thing that we did not want, meaning the issue of whenever somebody get killed, and then it's just the whole TV is just on that. That one I did not really. But I think for if you look at some of the write-ups in Pakistan, especially in some of the newspapers, they all had some message behind them. For example, first year I was there, Shania Nishtar, she was a lady who was running for DG. And she had an article there arguing the only way to eradicate polio in Pakistan is by using the army. And she is a professor, and she knows, and the reason she was saying is anything when there is anything that has any monetary issues in it, that whether it is polio or other things, and she thinks that the country is not ready enough or transparent enough to do things properly and finish it. So she was advocating, for example, the army taking over the polio eradication program. This is way before all of the problems that we have. The way they are holding them responsible for what happens in the field, like when they see children vaccinating and stuff like that. That's also very important. But there are two or three writers there were which really bring out, very, very. At the end, they all go back and they blame the government of not doing what is to be done. But holding the government like that also responsibility also was good.
Hamid Jaffrey talked about accountability and transparency. Just kind of those themes came up in our conversation.
Yeah.
And I'm hearing accountability come up with you today.
Yeah. The issue is, let's say, okay, for me as a WHO team lead, or if I have a district, if there is one district that I an issue with, I have to have someone who I go to and say, okay, what happened? So someone who I would say, okay, you are responsible for this. Although that person may not be responsible for everything because he has to work with the government, but at least from my side, I have someone whom I have given specific activities and ask what happened these activities. And the same thing, somebody could come to me directly and say, why is the Pakistan program not moving? And I have to be able, the one who has to answer it. But nobody in the government structure or in any other places, there is that you can go to someone and say, okay, you are responsible. How come there are 20 cases in your town? And you see, to overcome those ones, there are activities that needs to be done. Bringing in people for a meeting, chairing meetings, and all of these things that we put as part of our performance indicators. For example, we follow religiously how many meetings do these mayors or DCs are holding. Not any meeting for polio. And then we say, where is the minute? It's not just, So these are the kind of thing that we like, because I remember the story I told you last time when a friend of mine told the chief minister that the response it's you. Because whenever each of them, if they take that responsibility that is on their shoulder and make sure that things happen, there's no problem. There won't be any problem. But if the guy does not care, as like we have a big problem most of the time in deputy commissioners who are working in Islamabad and especially in Islamabad, because they are so busy with other things because they're in the capital city. This thing for them is nothing, And no, he also has to be responsible for those. So those accountabilities is very critical to really overcome, because these are big challenges. So if someone does not own them, they won't go anywhere. And then to be clear of what you are asking for, what you want. You don't come up with new rules every time and say, okay, last time I have asked you about it, but that's where the transparency also comes in. So we started a dashboard where we look into different things and then we on our side have also to kind of verify what those dashboards say, whether it is just a kind of a quick way of giving everybody green or it's really that's how it is. So, but the problem is also, you cannot keep emergency situation for a long time. Now this has started in 2012, and I'm not there now, but I bet you that it will not. The enthusiasm of everybody after how many years now? 6 years or 7 years? Cannot be as high as it was before. So we need to also to come up with new ways of restarting that momentum and if you do one thing for 3 times and everybody knows what are the main things, and you don't have to work very hard on them because you just know what do you need to write in the report. And
because you brought up Reinvigoration, would you talk about some of your roles after, like 2014 returned? Did you return to Atlanta? You were in Jordan.
I was in Jordan.
Okay.
I came back to 2016.
Okay, and so in 2016, would you say that part of your activities included reinvigorating polio activities?
Yeah, I mean, then by 2016, we stuck with the 3 countries, in which that they were all in high alert. Each of them had EOC, Emergency Operations Centers.
Tom Frieden had activated?
Yeah, no, them in the countries too. There is an EOC in Pakistan, in Nigeria, and somehow in Afghanistan, but not only national but also provincial EOCs. So that can continue to keep the engagement of the government and the partners, but we have to finish it. I mean, we say 2018, 17 would be the last. We already have 3 cases from Afghanistan this year, at the first part of the, early January. I think, we are not working only for polio, we're also working for overall public health. I think we cannot keep going like this, number one, because we cannot afford to lose. Because losing and not finishing means the virus coming back roaring, because we are not immunizing as we used to immunize before. So there's definitely low immunity across the globe. So if this virus gets out, okay, first, if this virus is not eradicated and it keeps lingering and it gets out and goes to places where there was no vaccination, it will be a disaster. And if you remember, I don't know if you remember, but the cases that we had that came from Nigeria, in Somalia alone, there were more than 400 cases. So you can imagine how the world will look like. So we owe the world that we must finish this. And then, we also have to prove that this eradication initiatives are not just something that somebody cooks up and say, okay, I want to be famous and let me do it. But it has to be based on scientific informations, which would allow us to think whether you can spend so much money on one disease and do it or not. So if we are not successful, no one will ever come close to anything that has anything with elimination or eradication. The malaria eradication program that was in the 70s actually kind of held back a lot of people from thinking of eradication until we saw what happened with polio in South America. So we can't afford to lose. And I think what we have to do now, and what everybody is doing now, is really concentrate on these 2 countries and do whatever is necessary to at least finish it by this year, and then get ready for the outbreaks, which is not from the wild virus, but from vaccine-derived virus. And that's what I'm spending most of my time on now.
I spoke with Dr. Bill Faggy, and one phrase that we mentioned certainly after our interview actually was missed opportunities. Looking back, are there any missed opportunities that stick with you?
I think to me I could say 2 things that we should have known before. The number one thing is recognizing and understanding the countries' relationship within each other in the countries, like minorities and so on, those who are neglected. And I think probably we did not think that it will take us this long. But for a program that has to go into every house and work with every community, to come strictly through the central government and just only work with the central government and impose things on others, that we should not do. We should be able to really figure it out from the very beginning, that this is we have to open our arms and work with the community from the very beginning. That's number one. And we did not do that. Number 2 is we should have started at the toughest places. And the reason I'm saying is of course, it may be easy to start with places that have, but we should start at the toughest places, not in neglecting others, but making sure that we understand all of the issues that may come up in these places like war zones or places like, big countries like India, to really think and come up with the strategy in advance and make sure that the funding and everything is available and not to go into it like a frog in a warm water, that's what I would do. But I think this is missed opportunity, but I think the thing that we have learned from this also is really amazing. The ability to even manage such a huge program, the ability to bring in social mobilizers into really, when I mean by that social mobilizers, I'm talking about two places that have never ever been known before, places that could not have been on a map, and not the logistic part of reaching there, but reaching there so that you can talk with people. During the AIDS crisis, the Ebola crisis, if you see what the polio team did in Nigeria is really exactly what it is now. They should have done the same thing in the other countries because, for some reason, we knew and we know at the community level, every community. So even when you have issues like that which require the consensus from the community, you can use this system. The surveillance activities that we have told people, now surveillance is known by villagers, of what are they looking for. So not only that we have reduced the number of mortality and morbidity from the virus, but we have really changed and brought in a lot of things. That the thing that we have learned from is also a phenomenon, and we don't want that name to be tarnished by not being able to finish it.
Last time you talked about work in Somalia and South Sudan as having an impact on the ways that that WHO and UNICEF work. Could you explain some of the evidence that you see of the experiences in country impacting the orgs?
Yeah. Like I said, UNICEF may already had some operation in the field, but WHO, as it is, everything was expert-based support to countries. So WHO was never engaged itself in operation, meaning implementing activities, direct implementation. And if you remember, during the Ebola outbreak, there was a lot of question that WHO was asked, and how did it allow to go this far and this, how come we cannot hire people on time? All of these kind of stuff, WHO was never part of it, never. All they used to do is send one person. But with the polio is the first one that really entered into mass implementation activities, where you have to have our own HR, our own budget, and our own everything was our own, because the other part did not have it, did not need it. Now, even now when they talk about when people talk about emergency protocols, for emergencies, and what they try to do is they take the country activities as if country does not have any emergency. Like, let's say you take a small country which has one one representative, one epidemiologist, and 2 or 3 people, drivers, which is the majority of countries. And you can't, somebody who's expert in that cannot tell you what to do if there is a major outbreak in some country where you have to bring in, 50 people in one day, work on millions of dollars and write reports, So that, and everybody who was working, not everybody, but most of our people who were working in management and HR were taking for the Ebola, because we were the only ones who had that experience. And that is on the WHO part, but also on the country side, these are places where they could not have afforded or were capable to train those many people in their own countries. And you will see them taking a lot of really high positions once the country settles or is liberated, like what happens in South Sudan. I mean, really, it is we have our footprint is in every district of every country.
Having laid that footprint, I wonder how that's changed your kind of mindset or opinion or perspective on global health systems.
Yeah. System. I think global health system, I don't want to say this and that, but I think we should start with really helping countries to be able to plan, comprehensive planning. And that is where you start to kind of use the strength of different programs, how, and once you plan and you know where you want to go, and then you start asking, what do I have to put in place? So, a lot of countries are just caught in between each and everybody. I go with polio, tomorrow the other one comes and say, health system strengthening, and, so if the country does not have a plan, all of these noises that comes in would just be another annoyance, because that official doesn't have, a document that he goes back for himself and says, okay, where does your input fits in? We're not doing enough of that. We really need to strengthen, or to help countries to be just able to plan and see what is based on the situation that is in their own hand, and see what is required, not just us coming in and saying, okay, I am this today, I'm that tomorrow. Yeah. It's a long process. It's a long process, and yes, there is always this fight between vertical and horizontal, line of thought. I think people will not change, people from outside, because it becomes like a religious discussion. Everybody is holding his own belief and then trying to argue, but it is never one or the other. And there has to be some horizontal kind of mindset, and it will be very useful if the countries can lead that, because all of us come from our own viewpoint and what we want to do, and what we want to do is another thing, but the one eventually that we serve is a country, and that country has to help us, or they have to force us to kind of follow their plan and their thinking. If they allow the polio program just to work by itself and not force it to kind of help other programs, you know, it will be the country's fault. And I always tell them that, you know, it is, you take advantage of this, we will bring this, we need this outputs, but see what else you can do with this activity, with this support that we give to strengthen the other health system, the other health activities. And few countries do that because, again, programs run by people, individuals, who each one also want to have his own, you know, his own legacy and his own palace and everything. So
I feel like we're kind of starting to wrap up a
that's
little
very
bit.
good.
It's just before 3 o'clock right now, so we still have some time. I have a list of some kinds of loose ends a little bit. We didn't talk really at all about Djibouti, and so I wanted to see if you wanted to say anything about your work there.
I call it a drop in the ocean, but no, Djibouti is the total number of, I mean, it's a very small country, but it's a very difficult country. You know, one time I went to India, arguing up in Moradabad, you know, big country with millions of kids to be immunized, millions of dollars. And then I went straight to Djibouti from there. And I can tell you, I had the same problem. You know, going and arguing with the ministry and then, you know. So it is a country that is somehow neglected sometimes. It is at risk of getting a virus from either Somalia or Ethiopia because it's right in the middle. But the good thing is, you know, it's a very small country. You can do it in a very short period of time, you know, whatever you want to do. And that's what we used to do. We used to go and not only immunize with polio, but we immunize with all vaccines, you know, 3 times a year. Yeah, we had to establish a surveillance, which was very difficult. You know, we may need only 1 or 2 cases, but it's only one. It's a city. It's a country that is only one city. But it was in our radar, and we were going there pretty often.
You brought an item with you, so I thought I would ask you to describe it today for the archivist Laura Frizzell.
Yeah, that is during the killing, during for the campaigns.
And it's, just to describe it, it's a red paddle.
Yes, it's
made out of wood.
Yeah, it looks like a tennis thing. Yeah, and we were distributing it to the police that they can use it because in Islamabad there are a lot of checkpoints when you travel, and so, you know, they have another stop sign, you know, to stop sign, but we were giving them this and agreed to give them this so that the public also knows that the police is also part of the whole thing. So, you know, it's just building confidence of the vaccinators that the police is also with them. So it reminds me of those tough times.
Thank you. I just remembered a scene from Every Last Child. It prompted a question for me. There's a scene where there's a vaccinator team who's been working, I think, at a checkpoint, maybe 3 men in yellow.
Yeah, they said with yellow. Yeah.
Yeah, they're working together, and this is right after
the Karachi killing.
Yeah, and suddenly there were no police to work with them. There was no security with them. So my question is, what was the impact on vaccinators, of the killings on vaccinators?
Oh, it's usually devastating. It's devastating. I mean, the other thing is, I don't know if I say it loudly, you know, after the police started escorting them, they were the ones who also started to be attacked. So even the police were attacked. But it's just impossible. And for them, for example, they were outside by the on bus stops where they, you know, where they immunize children who are on the move, and you can't have one police for each of all of those people who are working in the street, and it really frustrates and demoralizes the vaccinators. Not the fact that they don't have a police, but the fact that another incident had happened. But I think what I really want to finish with is how much in debt we are for these vaccinators. Not only in Pakistan. I said this before also. Really, if there is any way of thanking them, I think I don't know why they are not being put as Nobel Prize winners, because what they have done is absolutely fantastic and not fantastic. It's not the work that they do, but the enthusiasm that comes out of them, like those ladies that you saw. One of her relatives is shot, but she still goes out, and then she still bring her little daughter, and then standing up and saying, this is what we do. And imagine, I don't know, one day I will sit down and count all of the number of doses that we have given. So where each place from Indonesia all the way to Senegal, where each house been visited by these people. Whether it is up in the mountains, riverine areas. So I think we really are, the children are really, the final result is for polio is that we see really. We don't see much, or we hopefully will not see a single child who is paralyzed. But I think that could not happen without these vaccinators. They are the most important component of this initiative. We all are just enablers, but they are the ones who have done it.
There's a question that's kind of forming for me right now. I was talking with a friend of mine, and this friend of mine does environmental justice work in New Mexico. And he said something that made me ask him, how and when do you offer congratulations and praise to your staff and the people who carry out the work on the ground, and how does that translate? He was involved in fundraising, and so how does that translate when you're working with donors, I guess, too? And so I wonder, for you as a manager of large staffs over many years, what you think about that, how and when to acknowledge people.
I think there are different kinds. Like the vaccinators, day and night. The rest of us, I'm not sure. One day we were sitting in a meeting in Pakistan. It was a big kind of consultative meeting. So, everybody came from everywhere, and then, as a joke, we started to count the years that we worked in polio, and all of it. There were about 600 years or something. But anyway, it was a very big meeting, very expensive meeting. So at the end, now, we spend this much money. So I'm trying now. I started looking for what is the output here now. Okay, so many people here. What is exactly? Forget those what the nationals would do. But what are you guys doing here? So everybody was starting, thanking them for coming here, congratulating. I said, no, wait. No. There is no congratulation. I know you all paid per diem. I've paid almost $500,000. You're not going to come out of this house until you give me your last report and what are the action points. No. You know what I mean? I mean, you don't. We don't. I mean, I just don't like just to go a place or to have a position and not perform as we are asking people to to do. So congratulating vaccinators, yes. The rest of us, we are always trying to hedge around and figure out how to do so. We just have to show that what you say that. I mean, we are paid well, by the way, huh? So it's not that. Yeah, I mean, there are times when you see people go out of their way and do things, but for the normal work, last time you asked me a question, and I remembered. It was in Nigeria. I had international state coordinators in each of the states, and also national coordinator. So I was driving around from one state to another state just to get a quick update, and I do this very frequently. So I reached Kano with my other staff. So before we arrived, we tell them, look, we are coming. So not in a rush way, but it's just we need summaries and conclusions and whatever. So the two guys were sitting here, one national state coordinator, another one international state coordinator. And for every question I ask, it is the national one who is answering. I say, look, really, can you tell me? And they say, oh, let me, all the data is there with the other guy, with the national. Then I just pick the phone and I say, call Abuja, and I say, okay, I'm changing the state coordinator. From now on, he is the state coordinator, and that right there. I mean, that's how we work. So it's not. So I'm appreciating the other one, the one who's doing his work, but the other one who just sits there and takes the name and does not follow based on the position that he's holding.
Make that adjustment, which is one example of where you had the authority and the ability to make fast change.
Yes.
And I'm going back to wondering, and the question of what does, if you are able to set up these systems yourself based on what you observe in country and what you see and what needs to happen based on polio. You said there's a third way, right? Which is the polio way. What does the role of these other orgs become?
No, I think that you cannot do it by yourself, because I didn't have anything. I don't have money. I don't have any. But all of the authority and everything is given to me, and it's given to me not because I was working for WHO. It was given to me by WHO, by UNICEF, by CDC, by everybody, and that's really a very fantastic accomplishment. But I think the reason that I was also able to be like that is because the management, the overall management, the Bob Keegans, the Bruce Award, the UNICEF, they were also so cohesive and talk the same language and have the same vision, which really opened the platform to do that. Now you cannot do 1/3 of that. I mean, you cannot do any of that. Now it is like, okay, it is a much more organized in a way that everybody knows what's happening, and it's not run by few people, but the bureaucracy has become too much now, and of course and when you're in the country, you still have that power to decide what to do, and that doesn't mean that's taken away from you, but if your work has really a clear goal, a clear strategy, a clear way of modus operandi, that how you want to do, how things need to be done. Most of the time, we don't know why we are here, why we are wherever we are. What is the system that will carry us? We just take a job, and a job is a job. But if you go with a way that with something that you believe in, not only believe because it is something that you want to believe in, but well tested, evidence based. Clear strategy, clear objective, It makes them so much different in being able to do what you need to do.
Another list question. Tough questions that you've responded to. Are there certain conversations or certain questions that you have memories of responding to that have been particularly challenging?
I mean, I think the question about why are you coming to us all the time from the community, and just trying to convince them with the small little things, which is not being, telling them the truth that they are. That is the toughest question. Why do you come all the time while we have so many other problems that you can't listen to us? But in work and with my peers, I don't think that is a tough question.
I think that has covered at least this interviewing, guys.
Thank you very much.
Thank you. Is there anything we haven't covered?
No, I just want to say again. I just want to repeat the few things. And I think polio. The other thing that it did was really it has demonstrated how you can bring together so many different partners in a way that it's really not only smooth work, but really very, very synchronized work. The issue of the vaccinators, who are still remain the hero for us, and the fact that our success is not measured by how many millions of children we reached, but it's measured by what did we do to fix those who did not reach. So, like for example, in Pakistan, we immunized 40 million children. The numbers doesn't do anything for me, but it is how many did we miss, and what are we doing to correct that. So it's not just how many we miss, but also it has to be it has to be measured. How do we overcome the challenge of that led us to miss these children?
Which kind of multiplies if you're considering imported cases, other places, or exported cases, I guess.
So it's not how many children we reached. It's who we are missing and what are we doing to correct that.
Do you consider polio eradication a movement? There have been several people who have used that language.
I think it's just it's a public health intervention. Movement is too much. We haven't reached there, and we don't want to reach there. But it's a very challenging, and I think it looked very easy, and it is not easy. It was not easy because of what I mentioned to you earlier. The deficit of confidence on some of the population in countries is the cause that has brought us where we are.
So in the case of Pakistan,
every country that has lingered behind, that's the problem. I mean, that's the common denominator that we have.
But it seems in Pakistan specifically that thinking of it and describing it as a movement could be a disservice.
Of course, it will be disservice, but it is, it is something that should have gone long ago, like back in 2005 and 2006. So it is, and it's gonna, now these days we are talking about, 2020 there won't be any more GPEI. So a movement will last forever, but this is, a very, how can I say, a public health intervention that really touched large population. almost every child. Yeah, in addition to others that I mentioned in conclusion, like the vaccinators and the partnership and lesson learned and all, I think we cannot really say that we are where we are without the engagement of the Rotarians for different reasons. Number one, they are the ones actually who started this initiative from the very first, when nobody was there, and they have given it such a safety net that others who are bold and based on the science could take it further. Number two, it's just like the volunteers that we discussed earlier with the vaccinators. These are groups of people everywhere across the country, across the world, who had nothing to do with this activity, but they spend so much energy and time on it. They're volunteers. I mean, a lot of them are not physicians. They don't even know what is going on, but they believed in this initiative so much. And number three, really, the dollar amount is not what we count, but I think the advocacy that they bring in, not only in countries like Nigeria or India or Pakistan, but also here within the United States and everywhere else, and they are something that any program would be jealous to have, not to have them, because we see a lot of other programs which are trying to also achieve eradication. And for example, measles, to be frank with you, it never had some friend like the Rotarians for polio that could really push and carry the activities to the end.
What about, I'm considering the dates, the Bill and Melinda Gates Foundation became involved in 2007, and just because Todd brought up Rotary, I'll go ahead and bring them up because you worked closely with WHO and UNICEF, so they came up anyway.
Yeah, I think the one thing that happened back in the 2000 some years back is I think overall what I can see that what the Bill and Melinda Gates Foundation brought for us is, in addition to the money, is really to look into the way we do things differently. Differently, whether it is technologically or even thinking about it, and trying to come up with really new ways of doing things. Things that could have never had happened. Like for example, in Borno, in Nigeria, you could follow vaccinators, where they are entering based on the GIS system that we have. So bringing these new technologies, bringing in, of course, the funding is fantastic. But in addition to that, forcing us to think more in how we do things right, and be able to really, finish the job. So they're coming in, and not, and then funding wise also, in a lot of places, I think, it's better if billionaires talk to billionaires, not a leader talk to a billionaire. And his role in that fundraising had really helped us tremendously, because what I said earlier about the Islamic Development Bank loan, the Japanese loan, the UAE loan, all of these things would never have been even close to us if he was not there. So it's really been a very, very timely addition to the partnership.
I wonder about, so the GPI actual architecture started, I think our archivist has traced it back, and it's consistent with what I found too, to around 2010, when there was a POB, Polio Oversight Board, and that structure.
Exactly.
How did that structure, that organization, impact your work?
Yeah.
How?
It put too many structure into play. That's what I was hinting to earlier. it is good that, like you, as you know it very well, it brings everybody together. But it's also became very bureaucratic. You can do this for any activity, for any kind of thing. Let's say you have a big factory, and you can have this kind of setup, or you can be, how can I say, an NGO that's trying to, or a group of people that tries to reduce or eliminate, homelessness or whatever. The structure it should work for everything. But all I know is I'm eradicating polio. So if I sit down and listen to the talks, I hear a lot of talks, and very rarely I hear polio there, because we're talking about systems and structures and budgets and this and that and that. So, I'm always attracted to that polio word.
Would you say that that organizational structure introduced barriers or impediments to your work?
Barriers, not impediments. Because, before, although it was, then you have to have a benevolent leader. There was only one person who decided all of these things. That's why I'm calling it has to be a benevolent leader. So for a decision-making process, it was not that difficult. It was not difficult. Just one person or few people decide, and we move forward. So, but now this consultation is good, but it's taking a long time to do things in the field. Which
is particularly difficult with a disease like polio.
Yeah. Although to be frank with you, the thing that is done in these endemic countries has not been impacted very much by the structure, because still the structure that was put in the endemic countries, by everybody, whether it is government, WHO or UNICEF, is so strong that it can sustain and maintain themselves. All they need is the money. So they come up with because remember, it's with the EOC, this is a consultation process that the government is leading. So none of us, once that decision is made, none of us has anything to do with deciding to go ahead with that or not. You know what I mean? So for the endemic countries, that it may have helped it more actually.
Along that line, do you think that the structure boosted accountability? What do you think the impact was?
Where?
Of the GPI architecture coming in, being established. Part of that, like the IMB, is intended to support accountability.
Yeah, absolutely. Overall, accountability is now so different than it used to be before. At one point, all of us were just happy folks running around and doing what we need to do, and we were doing good. But I think when things start to stagnate, and we want to know why this is stagnating and who's responsible for it, and today also we ask those questions. If there is a response that is planned, and some group say yes, and the other group say no, and then each of them they say, look, you will be responsible if this outbreak goes out of hand. The other one says, you'll be responsible if the vaccine gives us circulating vaccine drive. You know what I mean? It's no more just let's go ahead and do it and be happy with it.
Any other thoughts on any of the individual partners or GPI in general?
Yeah, but I think, at the end of the day, for us also, it is, I'm talking about for CDC, I don't know if we talked enough about really the culture of our team here in CDC from the get-go. It was really wonderful. It was like a family, affair. It was not big as now, but it was really a family affair, and we all credit this to Bob Keegan, who was the deputy chief here, and it was a wonderful time. And it was a special team where everybody wanted to join, not only because of the achievement and the work that we were doing, but also that being together, sense of being together. And I think we have been really we can stand in front of the Congress and say that we really have done our job very well. And we would like to continue to be the vanguard of eradication, not just to, somehow lose the, I mean, sometimes, there is some politics and other things, where how you see things, how we move forward. For us, it's not done until it's done. And we will keep supporting the partners in few things that we feel like it is our forte, surveillance, laboratory data management. And we're working very hard with the whole division how to transit this to supporting overall immunization. And I hope they're all doing that, I hope.
Because you brought up the culture of CDC, and maybe this is where we close. Could you tell a few stories about that culture of CDC when Bob Keegan was deputy? Because I think that that's really important. And this was after the polio eradication activity was the beginning.
Yes.
At CDC, and it was a 6-person staff. So the time that you're remembering, was that after?
Yeah. Okay. I mean, this is after, we were such, so close. I mean, so close not because we were just kind of thinking alike or we were friends or anything like that. I think the enthusiasm and that we had for the polio eradication based on the strategy and the objective it had, and being able to go out and really just implement it, and the support that we had for each other from here to that. So that is what brought us much, much closer, to the extent that, my kids have been advised, and even now, by my colleague, whom I know through in polio. I mean, just as an example, when we were overseas, we used to come back every now and then. So when I come, for example, with a family, I have to rent car. So then I say, why do I rent car? So I went and bought a car, and then I leave the key in the office. And then when RNA travels, she leaves the key in the office. So anybody who comes from anywhere has the opportunity to have a car and a house. And we were doing this for all, it was, if my kids give me headaches, and I call RNA or Bob Keegan or one of them. They're the ones who take care of them. We, all of them really, they raised with us together. And this cannot happen if our communication is only work related and dry, and of course, we always talk about work, but in a different way. So yeah, it was a fantastic team.
Do you have any particular or specific Bob Keegan stories that are specific to Bob Keegan? Because we're trying to represent him, because I won't have a chance to meet him.
Well, the first time I went to Yemen, so I looked at it and then I saw, and I say, okay, now we can do campaigns. So I called him and I say, Bob, I need $375,000. And he says, where am I going to get it from? No, I say, you have friends at Rotary. So you figure it out how to get me that $375,000. I want my vaccines. And this is the first interaction that we really had in getting to do things. So in 2 days, he got me the money. In 7 days, we got the vaccine. In 7 to 15 days, we got the vaccine in Yemen. This is for activity that has never been planned by anybody before. But I mean, we had so many. I think one of the things that you will keep hearing, I mean, if you had been here, that you would have heard from him is his adventure in Ethiopia. Him and Tim Peterson, they went to supervise some activity, up northwest of Ethiopia, and they had to take a boat to go there, and the boat driver was someone from a tribe that had animosity with a tribe that they went to, and they killed them. So Tim and Bob had to run and escape by running like a day and a half or at night. So Bob loved to talk about that all the time. So, and actually, he even wrote it in his book. If you know. Yeah. But overall, Bob was always, he was. You're never bored with him. And he helped me a lot when I was in Nigeria. Also, stood up with me when I was challenging the Minister of Health, and. Yeah.
Do you feel like we've talked enough about Nigeria?
Yeah, I think we've talked enough.
Okay. Thank you.